Are you confused about what form you should be taking your cannabis medicine in? I'm Shari Kaplan-Stellino. I'm the founder of Connected Wellness. So what forms does medical cannabis come in for you to use as medicine? There are different delivery methods, obviously, I'm sure you've noticed. There are tinctures, there are capsules, there are edibles, and there's inhalation. And those are the basic ones that you usually see from state to state. So the form that you're taking your cannabis medicine in will both affect how quickly it takes effect and how long it's going to last. So tinctures take about anywhere from a few minutes to an hour and a half to 2 hours to take effect, but they do last 4 to 6 hours. Edibles, such as chocolate and gummy bears, take approximately an hour and a half to 2 hours to get their maximum effect, but they do last for about 10 hours. Capsules usually take anywhere from a few minutes up to an hour and a half to 2 hours to take effect, but they also last for 4 to 6 hours. Now, inhalation, whether it's vaping or inhaling actual flower, these medicines, usually react very quickly. So you inhale it within 15 minutes, you feel their full effect. However, it only lasts for 2 hours. So great for immediate relief, but not necessarily long-term. So which one is right for you? Well, if your doctor hasn't guided you, or if you want to go back to your doctor with some information, I have a few common sense thoughts that you might want to consider. So if you're using cannabis for neurological disorders, mental health disorders, or aiding in the treatment of different types of cancers. I usually say, cancers from the rib cage up. Using tinctures is an easy way for your physicians to dose your medicine so that you can get exactly and specifically what you need into your system. If you have gastrointestinal disorders, or you have cancers in the gastrointestinal region, or anything from the rib cage to the bottom of your torso, capsules are a great delivery method because you're actually getting the medicine closer to the receptor site areas that you need it. So edibles. I have one thing to share with you about edibles. You need to use these at very low dosages and then slowly increase. So if your physician recommends that you take 5 milligrams, don't buy a 10 milligram gummy and cut it in half, because the technology of making gummies might not be in your area, depending on your manufacturer, that you have an equal amount of milligrams throughout that gummy. So if you cut it in half, you could have most of the medicine on one side and not as much on the other. I am sure as technology continues, we won't have that issue as much. But for right now, if your doctor recommends 5 milligrams, get yourself a 5 milligram edible. When you increase that to 10 milligrams, then jump up to a 10 milligram gummy. So remember, if you start too high and you take an edible, you're into it for 10 hours. So please, please, please be very careful with the dosing of edibles. Now, I know that many people like to inhale their medicine to go to sleep, but I want you to remember that inhalation only lasts 2 hours. So if you're going to use inhalation to go to sleep, make sure that you're dividing it up maybe with a tincture or an edible, where you take half the dose in inhalation and half the dose in the edible or the tincture, so that it can last throughout the night. So many people say, well, I smoked before I went to bed and then I woke up a few hours later. So to which I would say, of course you did. So if you want to make sure that you're getting your medicine that is lasting throughout the night, you're going to need to pick one of the other delivery methods. And capsules work as well throughout the night. So I want to say to you, listen to your physicians. Take some of this common sense information back to your doctors with you if they haven't guided you. And I hope that's helpful. If you found it helpful, please like our page, subscribe to our channel, and remember, cannabis is a life-changing medicine, but only you can change your life.